on breast cancer awareness. Geeta and is all India detection AI of HR of India for technical programs and Bar Council of India for law programs. The institute is conducting postgraduate programs like MBA, MBA International Business, and undergraduate courses like BBA and BBA LLB and BBA BA LLB. Gibbs has been ranked second amongst the top B school of North Delhi in the Times B School Survey 2018 and 2000. Gibbs was with the sole aim to provide hands-on experience to young students in delivering community services. NSS, that is, National Service Scheme, is a central sector scheme of Government of India, Ministry of Youth Affairs and Sports. It provides opportunity to students to take part in various community service and activities and programs. And today's web talk is one such program. In this time of COVID, health and hygiene are prime concern. And our health. Pay more attention to our health and hygiene. This webinar of today will make us more aware about the same. To enlighten us on the topic of breast cancer awareness, we have with us Dr. Ruchi Rai. Dr. Ruchi Rai is a consultant obstetric and gynecologist, breast physician, and infertility specialist. She has completed her MBBS from prestigious King George Medical University, Lucknow, Uttar Pradesh. She pursued her MD and on treatment evaluation of cancer cervix, clinical and cytological study from prestigious King George Medical University, Lucknow, 2000 to 2000 at KGMU, Lucknow, from year 2012, and gave the thesis on benign breast disorder, changes during various hormonal events, visual analog scale for assessing breast nodularity in non-discrete lumpy breast. As a consultant Nagar Hospital, Lucknow from 2003 to 2004. By 2006, she was established and was running one of its first kind breast cancer clinic at Department of Obstetric and Gynecology, KGMU, Lucknow. Before joining senior residency, she completed 3 years of senior residency in Department of Obstetric and Gynecology at Government Medical College and Hospital, Sector 32, Chandigarh, on 2000. She also of work consultant in Hospital, Sector 40, 2000, August 2000. At Happy Family Hospital, Mani Majra, and as Panchkula from May 2016 to June 2017, and a visiting consultant at Mukat Hospital and Heart Institute, Chandigarh. Ma'am accomplished her PhD at KGMU Lucknow in year 2012. Worked as head of the SGHS Hospital Sohana from 2011 to 2016. Ma'am has also contributed as senior consultant gynecologist at Paras Bliss Hospital Mansa Devi Complex, entitled Circadian Periodicity of Plasma. Her works on lipid peroxide and antioxidant as putative markers in gynecological malignancy. General. She has contributed to the General Development Evolution, General of Science Physiology, MU, Lucknow. She was awarded first prize in International Conference of Role of Free Radical and Antioxidant in Health and Disease held at KGMC in Feb 2003 for her presentation on circadian periodicity of plasma lipid peroxides and antioxidants enzyme in gynecology malignancy. She presented the topic benign breast disorder, an emerging health problem at 14 India Conference of Health Association, and on benign breast disorder assessment of nodularity scale at ASICON presented at 49th All India Congress of Obstetric and Gynecology at Kochi. Ma'am is presently running her own clinic and hospital in Sector 18, Chandigarh, and is also gynecologist in India who holds the degree in breast cancer disease. This she is the gynecologist in North India to handle breast and holds the PhD degree in more than 14 years of experience in this field. She is trained to manage breast disease by reputed professor of surgery from KGMC. Ma'am has been an adamant organ of the Federation of Obstetric and Gynecologist Society of India, FOGSI, Chandigarh Obstetric and Gynecology Society, COGS, Mali Obstetrician and Gynecological Society, MOS, Indian Medical Association, IMA, and has been acknowledged with many prestigious societies such as Silver Medal in Pathology for C Money, Dr. C Money Gold Medal for doing the best work on rural health during the internship. We're delighted to have you, ma'am. Please enlighten us with your words.
Thank you, dear, for your kind words. And today we have us here to discuss the important problem, which is breast cancer. So, can somebody enable my screen sharing?
Yes, ma'am, I'll do it.
So, I'll be talking about breast cancer, and for the past few years, breast cancer has taken over cervical cancer as the leading cause of cancers in ladies. So let us talk about breast cancer. So today we have assembled here to talk about breast cancer because if you see these figures, you will know that the numbers don't lie. And breast cancer is a very, very important cause of death in ladies. So somewhere in the world, a case of breast cancer is being diagnosed every 19 seconds, and a woman would die of breast cancer every 60 seconds. So over the next 25 years, we will have almost 42 million new cases of breast cancer worldwide. Another 13 million people worldwide would die from breast cancer. So this is the reason that we should know about the breast cancer. So few years back, cervical cancer, that is the cancer of the mouth of the uterus, was the most common cancer of the females. But now the breast cancer has taken over. Who are followed by the cancer of the intestine and the stomach cancer. If we figure in India, around 200 women diagnosed cancer, and around 5 men will also be diagnosed with breast cancer. And the death would be nearly 700 people annually. And the lifetime risk of having breast cancer is 1 in 10 women. So before discussing it, I would just quickly tell you what the breast tissue. This is the milk with this form of lobules from the nipple, and in between the lobules is the fat. Now, this fat increase or decrease will actually make the breast appear larger or smaller, whereas the other milk producing tissue would be sensitive to the hormones. And this breast pectoral muscle, the chest. Now, when the girls are growing, right from the start of the menses, that is at the puberty, till menopause, the breast undergoes a number of changes. This is because at the onset of puberty, there is a sudden, surge in the hormones of a girl. So there is a sudden change in the breast at the time of puberty. Then cyclically with each menstrual cycle, cycle, the start responding to the hormones, like the female hormones. So the first half of the cycle, hormone. Then after ovulation, there is the progesterone hormone which is produced, and once these two hormones, when the lady doesn't become pregnant, these two hormones fall drastically. Then the periods occur. So with each period, increase in estrogen followed by the coming of the progesterone and then falling down of the hormones lead to changes in the reproductive period. At a sudden surge of hormones, then cyclically with each menstrual cycle, there would be an increase in progesterone and estrogen followed by a downfall. At that time also, the breast will increase and decrease in size and become sensitive to these hormones. Then when the lady becomes pregnant, then it starts basically the prolactin hormone and the other pregnancy hormones have an effect on breast, and menstruating at the time of menopause, again there are hormonal changes. So the breast is a very hormonally sensitive organ, and right from the start of periods till the periods end, that is from the puberty till the menopause, these hormones will keep on acting on the breast. So the breast, all the hormones in the body, you name it, and the hormone is known to act on the breast. So many changes over a woman's life, the hormonal changes are known to produce a lot of non-cancerous problems in the ladies. So these non-cancerous problems are known as benign breast conditions. Benign means that it is non-cancerous. As fibrocystic changes. So the milk producing tissue, the hormonally sensitive tissue, becomes sensitive to the hormones and produce lumpiness in the breast. The other things that can happen is a fibroadenoma. Fibroadenoma means that one area of the breast becomes sensitive and it grows into a lump, which is a non-cancerous lump. Then there can be cysts in the breast, or they can be enlargement of the breast. So although we're talking about breast cancer, which is because it is a problem which can play havoc with your body, all breast cancers must understand, although breast cancer, but problems are stress problems of the breast. So the question is, what is breast cancer? What happens is that generally the tissue of the breast is under the body's control. So generally the cells of the breast will grow normally, and with time they die. But in cancer, one may get out the body control over, and that keeps on multiplying. And the stage that it starts spreading and it gets, there is no control of the body over that. So this is what cancer is in the layman term. So definitely for us women, the breast means a lot to us, because the looks, the sexuality, then you need to feed. So with the breast, so important. So definitely the term breast cancer is very, very scary. So firstly, let us discuss that what causes breast cancer. So a very family history can, a positive family history of breast cancer or ovarian cancer can put somebody to the risk of acquiring breast cancer. There may be personal history, and there are lifestyle problems that can be associated with breast cancer. So the risk factors are, one is increasing age. So the longer the breast is exposed to the hormonal changes, the more the breast is at risk of acquiring something bad like cancer. Is the hormone, the breast tissue, and the progesterone is second cycle protective. So the longer the lady is exposed to estrogen, maybe naturally or by external intake, the higher is the risk factor of acquiring breast cancer. Then there is an environmental or lifestyle problems. Family history also puts you at a greater risk, and sometimes genetic ladies have BRCA1 2 in their chromosomes are at risk. So the risk factor, the incidence of breast cancer increases with age, because as I said, the more you are exposed to estrogen, the more there you are. Breast cancer is uncommon before the age of 25 years. Then as one is exposed to the estrogen cyclically, the incidence is, but when the lady has menopause, when the periods stop, naturally the hormones fall down. At that time, the risk of breast cancer decreases. So almost 10% can be inherited by the genes, and a woman having a mother or a sister or a first degree relative with the history of breast cancer is at a 2 to 3 times risk compared, more risk to the normal. So there are also certain types of benign breast disease. The non-cancerous breast disease, which left over a long period of time, can lead to breast cancer. Sometimes the breast cancer is also associated with other other cancers like the cancer of the ovary or the cancer of the uterus. So a lady having a history of cancer of the ovary or endometrial cancer can also attend. Breasts are also predominant cancers. So the main culprit is the estrogen hormone, unopposed estrogen. When you have proper menstrual cycles, the first half you have estrogen, the second half you have progesterone to protect you. But certain conditions where only estrogen is at high level, then that time there is a risk of changes occurring in the breast. So these estrogen excess conditions are when you have an early menarche. Menarche means then your periods start, keep on going till a late age of menopause, because at the time of menarche and at the time of stopping of periods at menopause, there is unopposed estrogen, and the period of the reproductive period is a long way to go. So that time the breast is exposed to a lot of estrogen. So those who don't have children, so those who have children will breastfeed, that when they are pregnant, they have excess of progesterone. Progesterone is basically to those children, don't feed them, are at a risk of having breast cancer because their protective hormones have not worked on their breast. Those who defer their first childbirth, naturally, so progesterone and the pregnancy hormones are protective. If you keep on deferring your first childbirth, then again the chance of having unopposed estrogen is high. And same thing happens in obesity. Obese people have a lot of estrogen in their body. A lot of estrogen is produced outside the ovary, that is in the fat, and then again that leads to a risk of acquiring breast cancer. Other factors are like high fat intake, excess of alcohol, radiation, and mind you, 70% of breast cancer cases occur de novo. That means all the factors I have stated in the previous slide, sometimes they are absent. One and having a diagnosis with breast cancer. So The next is, when do you suspect breast cancer? Symptoms. So a lump is growing very fast and it appeared a few days back. So a painless, fast going lump is a dangerous lump. Nipple discharge as in a bloody one nipple discharge. Inversion, the nipple, which is actually, projects out, gets indrawn. Then there can be certain breast skin changes like these, like the look of an orange peel appearance. And along with these symptoms, if the lady has a strong family history, like a first degree relative having a cancer of the breast, like mother, sister, grandmother, aunt, etc. So again, the symptom is thick, which is often painless. And the ladies, what they do is they try to neglect because they think isme dard to hai nahi, koi problem to hai nahi, ye to just ek lump hai. So these lumps are very, very dangerous. Then discharge or bleeding from the nipple from one side. Then change in the contour of the breast. The way it used to look, it has changed now. Then it can be a change in the color or appearance of the black area, that is the areola around the nipple. So it can be like an eaten appearance, redness or pitting of the skin over the breast, like an orange peel. These are all symptoms of breast cancer. So the next question is, what to do if you feel a lump? The first thing is, do not panic. You go ahead, check the other breast, and then you need to reach out to a specialist, breast specialist, for a triple assessment. So you need to know what breast is. Assessment is a good, which means that there is one clinical examination by a breast specialist, like the doctor would ask you certain questions, then he or she would be examining you in detail. Then the second part of the triple assessment means that the doctor will be ordering a radiological examination, which means either an ultrasound or a mammography or by examination. Means cells that are there in the lump for and ruling out cancer. So triple assessment is done in a breast unit. The doctor would thoroughly examine both your breasts and even the armpits. Then, according to the age, ultrasound or mammography would be done, and then a pathological test would be done. So when doing a clinical assessment, taking a deep with so many factors that I had mentioned earlier, those all factors would be taken up in detail and a thorough examination would be done. And the accuracy of breast examination is almost 70 to 80%. So we are in 70 to 80% of the times we are able to, judge the kind of lump it is there in the breast. So the examination is the same. The maneuvers are almost the same like the breast self-examination, and we would be asking questions. Next would be second part of the triple assessment center. The mammography is the most often done the radiological examination done for the breast cancers, but this all depends on the age of the patient. So if the patient is more than 30 age, and we mammogram it radiation. Than 35, we giving breast. If the lady is less than 35, we can do an ultrasound assessment and we can actually make out whether the lump is solid or cystic. And in special cases, the magnetic resonance imaging is used, which is an MRI. But most often, mammography or ultrasound would throw some light on what kind of lump it is. So a lady less than 35 years, ultrasound is done. For more than 35 years of age, we do a mammography. And this is what a breast cancer looks like on a mammography. It looks like this white popcorn-like appearance. So mammography is a standard screening tool for the breast, and its sensitivity increases with age, because with age, the density of the breast falls and easier to diagnose as advances mammography. MRI is an option, but it is an expensive option. When we have cheaper options available, we generally use MRI in special situations. So we will may be used in special circumstances if there is a family history of breast cancer. So ultrasound, which we'll be able to locate the in the breast, but it's only when the lady is less than 35 and we are trying to avoid radiation that we use an ultrasound. So the third part of the triple assessment after physical examination and a radiological examination is the biopsy, that is the pathological examination. So basically, it is very important, because until and unless the pathologist gives us the report that there are cancers in the, not go ahead and in the biopsy we do is cells from the area in the breast where an abnormality is there, the suspicious area. We can put in a needle, take out microscopic cells, make a slide, and then examine under a microscope and stain it and examine. And the pathologist is able to tell whether it is it's a benign, non-cancerous or a cancerous area from which he or she has taken out the cell. Doing an FT, which is by range, and some take out the lump of the tissue, that is known as a core biopsy, and then again it is sliced and seen under the microscope. Sometimes if the whole lump is removed and given to the pathologist. So a biopsy is 100% required to make a diagnosis of breast cancer. Now people have this, many people, especially the villagers, they feel frightened that if you put in a needle and if it is a cancer, it will spread. No, you have to get this biopsy done, either an FNAC cannot give you any form of treatment before the diagnosis is made by the pathologist. So 100% biopsy is needed to diagnose breast cancer. So sometimes the lump is very small, not able to find out where it is by your hand. Then the ultrasound is a very good modality where the ultrasound person is able to make out the area, and there the needle is put and the center of the mass is taken for diagnosis. So this is known as ultrasound guided core biopsy. So biopsy can be FNAC, it can be core biopsy, it can be an excision biopsy, but 100% biopsy is required. So how do you screen for breast cancer? It is very important. So for early detection, one needs 3 steps. One is screening by an annual mammography beginning at the age of 40 years, because breast cancer by detection by mammography is only after 35 years. So you can do an annual mammography after the age of 40. You can go for a clinical breast examination from a doctor every 3 years at the age of 20 and to 40 years of age. And then you can do your monthly breast self-examination after 20. So 20 to 20 years of age and beyond, you start with your self-breast examination. In between, every 3 years, you can go for a clinical breast examination. Once you cross 40 years of age, you can get an annual or maybe a mammography once in 2 years. So this will help detect the cancer early. So there is no prevention, but early detection would diagnose breast cancer early stage, pretty much treatable. So this is what 40 to 50, you can get a mammography every 2 years. After 50 years, you can get a mammography every year. So is there a way you can prevent breast cancer grossly? No, because most of the time the breast cancer arises suddenly. But yes, we can make healthy lifestyle choices, which will prevent breast cancer as well as your healthy. So it is good to the weight, add protein, limit alcohol, and use of hormones, and bear children early. Breastfeed if you can, because breastfeeding and having children are some protective. They have protective role in breast cancer. So some risk factors are controlled, can be controlled. So once God has as do treat the treat systemic. Local treatments means surgery. Either you remove the whole breast in an advanced stage or at later stages, or you can remove a lump, the cancerous lump and the nearby area, and put in a implant and reconstruct the breast. Then you give radiation therapy to the local canceroscopic cancer, and then you add on chemotherapy. This is cancer and sometimes there is a biological therapy as well. I'll not go into the detail, but this is the treatment option. So the purpose of my talk today was just to give you an awareness about breast cancer, that one should know your risk. If you have a cancer, then you share of this, you should know your risk. Then you should be self-breast aware. You should know what is normal for you. So you should know how your breasts look like, how they feel like. You should be examining your breast after every period and should know what is normal for you. Then get yourself screened. You can get yourself screened by clinical breast examination every 3 years. Then found done and after one has to lifestyles. So
thank you so much, Dr. Ruchi. Ma'am, there are some questions which we would like to ask you. So
yeah.
There is one question which says, what are the lifestyle changes that lead to breast cancer?
See, as I said, see, if a person has a heavy, if he is heavy, then who does take alcohol, then those who have been, there's something known as menopause hormonotherapy. There are contraceptive pills. Sometimes these things are they can lead to breast cancer. And those who have not had children, those who have not breastfed, these are all factors which are associated with breast cancer, and one should try.
Second question is, are the in male same that of female?
These are the same ways that the male that then have with more, it has more of fat, it has so much of tissue. So in a male, it is easy to detect because it is a flat areola and nipple that lies on the chest wall. Symptoms are the same, but there is an early detection because the fat content is not there.
Thank you, ma'am. I think Dean ma'am wants to ask something. So ma'am, you can unmute your mic and you can ask.
Good afternoon, Dr. Ruchi.
Good afternoon, ma'am.
Yeah, these were the questions for thrown by me only that Florina is asking. Thank you, Florina, for asking on my behalf. Like Dr. Ruchi, you mentioned that the symptoms are same in males, and about the lifestyle changes that you have told, that no alcohol intake and healthy eating, regular exercising, breastfeeding. Now, I'm sure there are many females here who fall in this category, who don't take alcohol, who are blessed with children. They have already breastfed their children. They are eating healthy. Nowadays, everybody is taking care of their health. But still, is there anything apart from this that can be done for prevention?
Nothing else apart from is you share of the breast awareness, self-examination and breast awareness is the most important thing. So when becomes like, before the periods, the breasts are very tight and tender, and sometimes the patients have people have pain. So immediately after the period, the breast becomes soft and light, and at time it should be a routine with everybody to examine the breast and look at the breast in the mirror and do a breast self-examination. So the early detection is the only way out, because like cervical cancer, the cancer of the mouth of the uterus, there is a vaccine which is available. For breast, there is nothing at all available. So breast awareness and early detection is the only answer.
And is there any artificial way to increase progesterone, since most of us have already gone through the stage of breastfeeding and bearing a child?
See, there is nothing like this. Like, you start on just prevent breast cancer. But then there are situations like this thing, PCOD, right? There is a period problem where PCOD, there is an excess of, estrogen, and there is no ovulation, and the lack of progesterone is there. So in certain situation, we are able to give progesterone to the girl to prevent the lining of the uterus as well as the breast from having precancerous and cancerous changes. So we don't, as of now, we don't give on to work just to prevent cancer, but situation we feel there are excess of estrogens in the body, like in special situations when there are menstrual problems like PCOD and all, that time we do give progesterones, and that time the progesterones do help in preventing such changes.
Thank you very much. Florina, you can continue.
Yeah, thank you. But you can and you can ask questions. Okay, we have good saying, and he was a question.
Thank you so much, ma'am. Am I clearly audible?
Yes, you are.
Okay. Ma'am, I would like to ask that the free radicals present in the daily fast foods and processed meat, do they really cause cancer?
See, free radicals are known to cause so many problems, like right from the heart disease to cancers. But, some things cannot be controlled. So basically, we should try to eat healthy and take a lot of antioxidants. But then you cannot say that only taking free radical will prevent cancer.
Siddharth, you can unmute and you can ask your question.
Thank you, ma'am. Ma'am, breast cancer is a problem in our problem which many of the women and men who face problems, close problem, the doctor of the family. So how can we just think for
See,
them?
basically,
what steps can be taken?
What the purpose of today's seminar was to sensitize you about breast cancer. Now it is your duty to go back home and tell and teach your sisters and all the loved ones about this. So it is like a chain. I have started it, and you carry it forward. So awareness is the most most important. And you have the lady house not, because do not, then it will not be cannot be treated. Awareness, now you go ahead and teach them.
The next question, Anushka, you can unmute your mic and you can ask ma'am.
A very good afternoon, ma'am.
Good afternoon.
And first of all, it was a very insightful and informative session, ma'am. Question is, I'm talking about if a person is below 85, some what you can say the symptoms of PCOD, will he or she, I mean, she will be having a chances of breast cancer?
So because PCOD, in PCOD, there is an ovulatory problem. So you don't generally ovulate one if you have PCOD. So what you have to do is you have to change your lifestyle for that. So lifestyle means a healthy eating habit and an exercise. So because you your lifestyle, the PCOD gets corrected. But if in case the PCOD is playing havoc with your body, you have excess of estrogen, then like a gynecologist like us will give you certain medicines to counteract the excess of estrogens. And by doing that, like first making a healthy lifestyle choice and then taking medicines. See, a PCOD once in 3. So if not pains, that means estrogen is body. We generally counter effect of estrogen. So it's not that every PCOD lady will have cancer of the breast, but if you are able to, make healthy lifestyle choices, take medicines.
Thank you, ma'am.
Welcome.
Ma'am, there's one more question. Can a lump turn into cancerous over time?
See, a benign lump like a fibroadenoma. Fibroadenoma is a painless lump known as breast mouse. That kind of lump generally doesn't change into breast cancer. So there are certain hyperplastic conditions, very rare conditions, which can, over time change into breast cancer. So whenever a lady has a lump, then a triple assessment, including a breast biopsy, would throw us light where it will change into over time or not. And accordingly, we breast specialists, we guide the patient. So a benign lump which can turn into cancer should always be removed after thorough follow-up.
Thank you so much, ma'am. So Shraddha, you have a question. Please go ahead.
Yes, ma'am. Ma'am, I wanted to ask that, as you said that it cannot be recognized in early stages. So, any other changes that we can, we can find out that we have to go to the doctor or for
See,
diagnosis.
basically, as I said earlier, the breast breast awareness is the utmost importance, because you know what your breast looks like, you know what your breast feels like. Any change, just reach out to the doctor. There is no other bodily changes, and many a times the lump is like, it's just there and it get any proper pain changes. So any difference in the breast which you notice over time, if you've been examined, use and find out if it is cancerous or not. So no bodily changes are there.
I had one more question.
Yeah.
Many women have uneven breast size or shape. So are these changes also can turn into cancer?
No.
Or
So generally when a lady is born, no, both the same look or the size. So what is normal for you, so that's why again I'm saying be breast aware of the way your breast looks like and what it feels like. And if there are changes right from the start, naturally it doesn't mean that it is a cancer. And there is always some amount of difference in the two breasts.
Okay, ma'am. Thank you.
Are there any questions? If there are any more questions, you can unmute your mic and you can ask Dr. Ruchi. I guess the silence says that all the queries has been answered. So thank you so much, Dr. Ruchi Rai. You have been extremely supportive and very, very generous whenever I invite you for the webinar on a very short notice. Thank you from the bottom of my heart, ma'am.
Thank you, Florina. It's something very close to my heart.
Yes, ma'am. And I haven't met you personally, but then I'm sure definitely one day I'll come and meet you at your clinic. And thank you once again for your time. I know you have a very busy schedule, but you always take out time for us. So thank you so much, ma'am. So thank you, all the participants. I think we have taken all the, and now we will be having a small quiz. And this quiz is basically on breast cancer. So whoever will be the winners of this quiz will be getting a small goodie from Sanjeevani's site. So I hope we will have maximum winners from the college. And before I start the quiz, I would also like to show you all a small introduction about our organization, like what we are doing and how we are doing it. So let me do all through.
10 से 12 लाख कैंसर के पेशेंट लोगों को कैंसर डायग्नोस होता है.
You know, a doctor has about 4 minutes to talk to somebody, or maybe 3 minutes, or if you are in luck, then maybe 7 minutes or 10 minutes. But what can you gauge about an individual in 3 minutes or in 4 minutes?
I would see thousands of people going through a similar journey as mine without any of the resources that I had. I thought that I really need to do something which will bring this hope of life back into them.